knew they were in the middle of a revolution when they were in the middle of a revolution, but then years later they looked back and they said, wow, that was brand new. You know, equality for men and all of that stuff. We're in the middle of a revolution, and the way we look at the human body today is very different than what I learned in medical school. I learned anatomy, physiology, I learned, you know, the bones and the muscles and everything else. Today, we look at the individual cells. What are these cells doing in your body? That's what we're down to now, okay? It's almost like in physics, at first we looked at objects like we could feel and touch, and now we look at subatomic particles that make up those objects, okay? That's how we're looking at the body today. So, I'm Dr. Singer. My background is plastic surgery, which, and the reason I got into this field is I went into plastic surgery because I wanted to help fix people, mostly from the outside, right? Plastic surgeons know how to reconstruct people if they get damaged or they have a disease, and we know how to take care of burns and injuries and what have you. And we also know how to make people look better. So mostly focusing on the outside. Stem cells, on the other hand, when I discovered that the fatty tissue that I was removing with liposuction, all of a sudden I discovered that was the #1 source of stem cells that could heal you from the inside. I said, wow, that's very interesting. And I started getting involved with it. So the reason you're here, I have to guess, is you probably have a problem that's not getting fixed, okay? And you might be suffering from an illness, or you might have pain, and you know, you're not satisfied with what, you know, the treatment that you're getting right now. So I'm going to repeat this a number of times, but the 5 things to remember about stem cells are, first, #1, pain equals inflammation. You don't get pain in your body without inflammation. If you have pain, you have inflammation. Okay? #2, inflammation is like a sore that doesn't heal. Okay? In other words, if you cut yourself and it didn't heal and it just stayed red and angry and everything else, that's inflammation. If it heals, the inflammation's gone. But if it continues to be sore, it's inflammation. The #1 way to repair or to restore your body that's involved in inflammation happens to be stem cells. It's a natural way we deal with it. Hi. Welcome. Okay. The best stem cells are your own. Stem cells exist throughout our bodies. Those are the best stem cells to use. In fact, some medications that we've been taking, or vitamins or things that we've been taking along the way, it turns out they work by actually stimulating your own stem cells. And the best source of stem cells happen to be your fat, the fatty tissue. We'll repeat this a few times because this is going to be a test. What do athletes, famous athletes, know that the ordinary citizen doesn't know? Take, for instance, Kobe Bryant. About 5 years ago, he injured his knee. Everyone thought he was finished, done, everything else. You know, surgery on the knee works sometimes, doesn't work sometimes. He came back a few months later and averaged 30 points a game. What happened? He went out of the country, went to Germany, in fact, spent a lot of money, had some stem cells injected into his knee, and within a few months he was back running around on the basketball court. But this didn't make the news. Oh, maybe it did, but it was one little sentence. Peyton Manning, remember that? Peyton Manning, famous, You know, he was with the Colts and the Broncos, won 2 Super Bowls. Well, in between the first Super Bowl and the second Super Bowl, he injured his neck. And he read a little thing in the paper, oh, he had some surgery and his career is finished and that's it. Peyton Manning had stem cells in his neck, hello. And he came back and won a Super Bowl. What did he know about stem cells that everybody else doesn't know, okay? A lot. This is Darrell Reed, is a patient of mine. He actually worked with Peyton Manning, got 2 Super Bowl rings, and unfortunately our athletes get damaged beyond repair. You know, he's 32 years old, both shoulders, both knees totally demolished from playing football. And we took care of him, and he's back running on a treadmill every day and working out like he used to, and he's back in shape again. He was crippled, okay? So stem cell therapy has the potential of eliminating the need for surgery, okay? It has that potential. In fact, you know, most of the stuff we do is orthopedic related. In other words, joints and bones and stuff like that. I'm going to give you a prediction. You heard it here first. Within 5 years from now, all the orthopedic surgery that is out there, arthroscopy, knee replacement, spinal surgery, neck surgery, everything else will be in the Smithsonian Institute as something we study. And we were, oh yeah, they used to do that surgery with the hammers and the chisels and everything else. And now we have stem cells. And that's a prediction you heard from me, but it's not only my prediction. Even orthopedic surgeons are starting to realize that. Well, what's important to know? First of all, most people don't even understand stem cells. There's so much hype. There's so much news media stuff out there. You read about it in the, you know, various newspapers, magazines, you hear about it on TV. A lot of it is true, and a lot of it is kind of hyped up a little bit. The other thing is, most doctors don't even know about this subject. They just know what they read, and they know what they're told at their meetings, and they don't even know, unless you're in the field, unless you're doing this every day, you don't know, honestly. So you go, I'm going to go and ask my doctor about this and see if he agrees. He's going to say, I don't know, I don't even think it works. Okay, well, it works, okay? It works better for certain things than other things, but there's no question about whether it works. Okay, it's not necessarily the answer to all of our problems. It doesn't cure everything, but what it does do is it helps your own body heal the natural way it's supposed to, okay? Stem cells help your body heal the natural way. And what happens is, as we get older, we lose that capability. We lose the ability to heal ourselves. So, what are some of the what are some of the options you have if let's say you're suffering from knee pain, right? What are some of the options? You can sit in the corner, do nothing, and complain. That's number one. Number two, you can go the traditional route. No, my insurance covers this, my insurance covers that. I'll do this, I'll do that. And you take some pills and you get some shots and you do this and that, and many times it works. Maybe 25–30% of the time it works. But over a period of time, the traditional methods, especially for arthritis and certain illnesses that we see, doesn't work. By the way, 45% of the population of the world above the age of 50 has some form of arthritis. That's pretty serious stuff, okay? And that's, you know, anyway, number three is other options, okay? That's why we're here today talking. So, what's the problem with taking painkillers? Well, first of all, two of the most common types of painkillers that you can buy in any drugstore without a prescription, Tylenol and the anti-inflammatories, if you take them long term, they're harmful. Tylenol is the #1 cause of liver failure, okay, in the United States. And Advil and Naproxen and some of those other anti-inflammatory drugs, They increase the incidence of heart disease and stroke, and also make you bleed internally. Not so safe, right? Not so safe, not so good to take. I mean, once in a while you get an ache or pain or headache or whatever, you take it. But you take it large doses every single day, it's going to take a toll on your body. And what about opioids? We all know how harmful those things can be. If you take them, you get addicted. And we have a problem in this country with opiate addiction. It's pretty serious, actually. What about surgery? Most doctors won't sit down with you and say, by the way, you can get an infection. By the way, you can get a blood clot that goes to your brain and gives you a stroke. By the way, you know, you can end up staying in the hospital twice as long as you think. They don't tell you all that stuff because they'd scare the heck out of you and you would never have surgery. But this is true. And, you know, if you're healthy and let's say you need a knee or a hip replacement and you have the surgery, you're going to get through it pretty well. And, you know, it's relatively safe, but it's not 100% safe. And then if you start comparing results, especially with the knee replacement surgery really doesn't work very well. It's not the answer, okay? Now, we talked about inflammation. What is inflammation? I said it's a sore that doesn't heal. But just to give you an idea, if you took how it feels, if you took a wire brush and rubbed it across your face, that would hurt like hell, right? And if you looked at it afterwards, it would be all red and sore. And that's what it looks like inside your knee or your hip or whatever else is hurting you. It's inflammation. So traditional treatments, you know, such as taking pills and some of these other traditional treatments do not actually repair the problem. They don't fix the problem. They just cover it over, okay? They don't fix it. Now, we talked about using your own cells. This has been around for about 20 years. It's called PRP. Do you know that if you get a sprain or an injury in Europe, the doctor doesn't write a prescription for a pill. He takes a sample of your blood, spins it down, takes the plasma with the platelets in it, injects it into the sprain or strain. It's a natural therapy using your own cells. Okay, not exactly stem cells, but it resembles stem cells because it's your own cells going to work to reduce the inflammation and for many things, and many of the athletes use this all the time. Go to the doctor, get some blood, spin it down, take the plasma, the yellow stuff, inject it into the joint. It works, but only for a few months. Then you might have to have it done again. It's not a permanent change, but it's good. What are the 5 things I said you have to remember about stem cells? Inflammation equals pain. The best way to take an inflammation is a sore that doesn't heal, okay? The best way to heal inflammation is what? Stem cell. The best stem cells are, and the best source of stem cells are your fatty tissue, okay? Now, what is a stem cell? I've been talking about it for about 10 minutes and I didn't even define it yet. Well, again, as I mentioned to you, our body is made up of cells, over 200 different types. And each one of these cells has to restore itself, replenish itself. If you just think about your skin and you look at your skin and say, gee, that skin looks the same today as it did a week ago, it's not true. The skin that you're looking at now was changed from a week ago. And the way it gets changed is the cells on the outside kind of shed, and the cells from underneath, which are your skin stem cells, replenish the other skin cells. So you're constantly replenishing and restoring your body, but we get older and we don't do it as efficiently, okay? In fact, we didn't get into this, we won't get into this necessarily, but you can actually help people stop aging so fast by giving them their own stem cells. Because the aging process is really the breakdown of this system where we replenish ourselves. If we could replenish ourselves real fast and over and over again, we would stay younger, longer, and our organs and all our systems would be more youthful. So anyway, stem cell, number one thing I talked about, inflammation, right? It actually stops inflammation. The best natural way to stop inflammation is using stem cells. It's how our body does it. Okay. The other thing is, the stem cell can reproduce itself. Your normal cells can't do that. And it can also change into other cells. So that's what a stem cell is. In Spanish, it's called célula madre, the mother cell. Okay? All right? In Chinese, it's called ganqibao. I think it means the same thing. It's the original cell. It's the mother cell. Now, we do not use embryonic stem cells. That's what caused a whole bunch of controversy when it first came out. You know, they said, oh my God, you're taking cells from embryos and you know, whatever, and that's against this value and the moral issues and everything else. And that's how stem cell news started in this country when George Bush was president. And they enacted all kinds of laws and rules and everything else. The bottom line is we do not use embryonic stem cells, especially for treating human beings and for dealing with anything. We use your own adult stem cells. Embryonic stem cells, they're still being used in the laboratory, but not to treat people. Okay. Adult mesenchymal stem cells. They're found all over the body. They're found in the umbilical cord when you're born. Bone marrow is the most commonly thought of source of stem cells because 75 years ago we started using bone marrow transplants to treat people with cancer. Okay? So bone marrow is a source of stem cells. Turns out about 10, 11 years ago we discovered that fatty tissue has more stem cells and it's easier to get to. So fat is a very abundant source, and there's no moral, ethical issue about using your own stem cells to treat yourself. There is no issue. And just an example of why I think bone marrow is not a very efficient source is that when you're born, 1 out of 10,000 of your cells are stem cells, but by the time you reach around 50, 1 out of 400,000. When you're 60, it turns out 1 out of a million cells in your bone marrow is a stem cell. So you're going to have to take out so much bone marrow tissue to get stem cells of any kind of quantity that it kind of is, I don't think it's a good idea. Anyway, so we use fat. And it's a minor, very minor liposuction procedure. We get a syringe filled with fat, looks something like that. We spin it down in a centrifuge. We then take that concentrated fat, we add an enzyme, we put it in the incubator, and then that helps separate the stem cells from the fatty tissue. And then this is the product that we get, and then we filter that product to get rid of any larger particles that could cause potential harm. And we get a pure product. If you look at it under the microscope, these little round guys here with the nucleus in it are stem cells. And the other ones, we're going to ask questions later. And the other ones here are your red cells, okay, the bigger ones. And anything larger than 100 microns, which is the size of a red cell, doesn't get through that filter. And if we give it intravenously, we filter it again. So it's a safe product to use. Now, this is what we can do with your own stem cells. And this is a patient that had severe pain. The medial part of his knee joint, there's no cartilage there, okay? When he walks and stands on that, it rubs, it cracks, it makes noises, and it hurts. It's got inflammation, chronic inflammation that causes the cartilage to be lost, and then the loss of cartilage causes more inflammation. Can I get a glass of water? The voice is going. What's that?
the crack of the door. It's too warm in here.
It is too warm in here. Yeah, open that door for us a little bit. We're too hot. We go from, that's the trouble with this time of year, you go from too cold to too hot. Mm-hmm. Oh.
When you stem cells, when you take them from the fat, can you serve a dual purpose and take them from a fatty stomach?
Yeah, we can do that. Oh, we'll get into that a little bit. Well, we just got a quick question, and I'll answer it. Yeah, it does have a dual purpose. You get rid of a little fat in your tummy, but anyway, 4 months later, pretty much pain-free, and you can see space there, okay? What's that space filled with? Anybody guess?
Cells.
What?
Cartilage.
Cartilage! There you go. You got an A. Okay, cartilage. And we know this to be a fact because in large animal studies, the veterinarians use the same method I use, and they treat horses, dogs, and cats with stem cells, their own fat-derived stem cells. And they, you know, because it's a horse, dog, or a cat, they say to the owner, bring your horse back here in a month. We want to take a look. And they can take a look every month. And try to get a human being to come back every month to have you know, a scope put in his knee right after he had surgery or had stem cells in there, and he would say, come on, leave me alone. But a horse, you know, come on with me, and I've seen these pictures 3 months after injecting stem cells into a horse's knee joint. It looks like an ice skating rink. And beforehand, it looked like a wet dishcloth that was all wrinkled up. So anyway, we inject the knee. I use fluoroscopy for this purpose. It's always better. I mean, I used to do it blind, and blind is blind. You don't see exactly where the injection is. We use a very, very simple machine that doesn't have much radiation at all. In fact, you can go outside in the sunshine for about 10 minutes and get more radiation from sunshine than you will from this machine. And we can see exactly where we're injecting, and we inject right in the spot that is necessary. And so we get really nice results from that. You know, this is just another X-ray showing, you know, a more precise injection. Of course, you know, just stem cells alone isn't necessarily going to work 100%. We like to get you eating right, which means fruits and vegetables, the right kind of proteins, and then your body actually heals even better. Okay, the 5 things to remember about stem cells are pain equals, okay, inflammation is, okay, the best way to heal inflammation is, the best source of stem cells is, and your own fatty tissue. Okay. Class is very good there, remembering. Okay, we can give these cells IV. Intravenous stem cells actually travel throughout the body. First place they go is your lungs. But if your lungs are fine and there's nothing wrong with them, they go outside the lungs. So here you can see the first scan. This person, they're in his lungs, and about 8 hours later, the lungs clear, and look at that. The stem cells are in the prostate gland, and also in the back of his brain. Why did they go there? How come they go there? Well, stem cells have a homing device built into them, and you put them in the human body, and they actually seek out inflammation in the body, okay? And they'll go there. So intravenous stem cells, very good. So it can be used to help people with almost every disease. You know, people say, stem cells work for this, stem cells work for that. The answer is yes. The reason is practically everything that goes wrong in the human body goes wrong because we don't have enough stem cells. Everything. And everything that hurts equals inflammation. Okay? And inflammation is a sore that doesn't heal. And the best way to heal that sore are your stem cells. Okay, we'll go through that again. But again, people with immune disorders, people with immune disorders such as lupus, scleroderma, it's called autoimmune disease because your own body's attacking your own cells. They get so much better with stem cells. It helps. It helps. It's not a cure, but I have patients with MS and lupus not taking medication anymore. They just come back every few months and they get a shot of their own stem cells. It works. Even neurologic conditions such as stroke, MS, you know, various things including Parkinson's. Wait for the questions. What?
Tinnitus.
It depends on the source, but we'll go into that in a second. Anyway, we also can use it to make you look better, okay? I'm a plastic surgeon, so I think of that. And we can grow hair on your head with stem cells, okay? We can put stem cells in your scalp, and depending on the situation, we can grow hair. We can also make you look a whole lot better by putting fat back into your face, increasing the volume in various areas, getting rid of some of these folds around the mouth, making this flat area look more round. And she looks 10, 15 years younger. No scars, no incisions, no nothing, just stem cells plus fat. So some of the procedures we do here are covered by your insurance. Not the stem cells. Stem cells never covered by insurance, but some of the things such as x-rays and x-ray guided injections, things like that, could be covered by insurance. And we have a 5-step program that is covered by insurance if your insurance allows for it. And it's a way for us to reduce the prices for stem cell treatment. Because if we're getting paid by your insurance company, we don't have to get paid twice. So what are the 5 things to remember about stem cells? I'm going to ask this again. Pain equals?
Inflammation.
Okay. Inflammation is sore that doesn't heal. The best way to treat inflammation is? The best source of stem cells are? And the best place to get the stem cells are your fatty tissue. Fat is your friend, not your enemy. Remember that. Fat is your friend. Without it, we're in trouble. So, you know, fat is your friend, okay? Fat is your friend. You don't want to be too heavy, but don't be too skinny either, because we can't get stem cells from you too easily. Okay, so we're open for a few questions, so go ahead. You had one.